Moving right along, sometimes it's okay to trial a treatment as a diagnostic. So what does that mean? That means that sometimes you think that it is one diagnosis, and in order to confirm this, what you do is you would go ahead and treat it and see how the patient does the next day. There's nothing wrong with that, okay? As long as you have contingency plans for if the patient gets worse, and then you have differentials to back you up. What you don't want to do is go ahead and deploy a treatment without an idea of what the differential is and without some kind of backup plan. Sometimes you're catching a disease process kind of early, and sometimes a little bit of time, like a day or two, has to pass before the disease state declares itself, is what they say. So there's nothing wrong with trialing a treatment as a diagnostic, because sometimes it's not entirely clear. Just be sure that you have in mind what the full differential is and how you tomorrow, or the person that takes over for you, is going to address those things. And next point is, allow yourself to use all the tools at your disposal without judgment. This goes back to kind of being gentle with yourself, okay? Please remember that this field is way too complex for everybody to know everything by heart. I think when I was in my teens, I remember hearing this saying that as you get older, you don't remember as much, but you remember where to find the things you need to know. I didn't think that would happen to me, but it's totally happening to me. But I know why. It isn't that your brain can't hold as much information, it's that you're responsible for more information. I have to hold a lot more stuff in my head now than I did when I was 12. When I was 12, I had like 3 best friends, and I could remember all 7 digits of their number. And those were the only people that I called. So I don't think it's that your brain gets less efficient at holding things, it's just that the amount that you have to hold is significantly more than it was when you were younger. Same with medical training. So the experience brings you pattern recognition, not necessarily raw knowledge memorization. So if you find yourself needing to look things up a lot, especially in the first couple years of your career, be gentle with yourself and don't be too critical. Don't be too hard on yourself. Use all the tools without judgment. Do you remember hearing about how, for quality purposes, they introduced checklists in the OR? And that seemed to have a significant effect on reducing adverse outcomes and complications. The practice of medicine is so complicated that sometimes the surgeons can be helped with something as simple as a checklist. So please remember, even very experienced people can't remember everything all the time. You just need to remember where to look for things. So use all the tools available to you without judgment. It doesn't make you less of a clinician, it actually makes you a better clinician. If you can remember like 65% of most things that you need to know, and then know where you can look up the other 35%, then you're golden. And for the sake of patient care, it's never a bad thing to just double check yourself. Double check yourself. Reread research. Go check up to date. We're doing it all the time. It's only good for patient care. Your patients appreciate it.